Hello everyone, welcome back. In today's video, we are going to discuss blood pressure in detail. This is a very important topic for nursing students both for exams and clinical practice. First, let us understand the definition. Blood pressure is the force exerted by circulating blood against the walls of the arteries. It indicates how effectively the heart is pumping blood and how well the blood vessels are functioning. This blood pressure mainly depends on cardiac output, peripheral resistance, blood volume, elasticity of blood vessels. It also reflects the efficiency of the cardiovascular system. Now, let us see the components of blood pressure. There are two components of the blood pressure, systolic pressure and diastolic pressure. So, first is systolic pressure. Systolic pressure is the pressure exerted on the arterial walls when the heart contracts and pumps the blood. It normally measures around 120 mmHg. Second is diastolic pressure. Diastolic pressure is the pressure in the arteries when the heart relaxes between heartbeats. It normally measures around 80 millimeters of Hg, means mmHg. So, the normal blood pressure for a healthy adult is approximately 120 over 80 millimeters of mercury. However, blood pressure are depending on the age, stress and emotions, physical activity, obesity, diet, smoking, blood volume and hormonal changes. These are some factors. Now, let us see the classification of blood pressure. When blood pressure is within normal range, it is considered as normal. If blood pressure is consistently above 140 over 80, it is considered as hypertension. If the blood pressure is below 90 by 60 mmHg, it is considered as hypotension. And if the blood pressure is nearly 120 to 139, then it is called as pre-hypertension. So these are the classifications. Now let us see about hypertension. Hypertension may be caused by stress, high salt intake, obesity, lack of exercise, smoking and family history. Sometimes hypertension may not show symptoms, but in some cases it may experience headache, dizziness, nose bleeding, shortness of breath, etc. If not treated properly, hypertension can lead to serious complications such as stroke, heart attack, kidney failure, retinal damage, and myocardial infarction. Now, let us discuss about hypotension. Hypotension means low blood pressure, usually below 90 over 60 millimeters of mercury. It can be caused by dehydration, blood loss, severe infection or heart problems. Symptoms of hypotension include dizziness, fainting, weak pulse, cold and clammy skin. Now, coming to hypotension's symptoms. Now, coming to measurement of blood pressure. Blood pressure is measured using a sphygmomanometer. The cuff is placed around the upper arm over the brachial artery. The patient should be in a relaxed sitting or lying position and the arm should be supported at the heart level to ensure accurate reading. Finally, let us see about the responsibility of nurses. Nurses should monitor blood pressure regularly, especially in patients with a cardiac or renal problems. The readings must be recorded accurately and abnormal values should be reported immediately. Nurses should also educate patients about lifestyle modifications such as reducing salt intake, maintaining ideal body weight, regular exercise, stress management, and medications. To conclude, blood pressure is one of the most important vital signs that reflects cardiovascular health. Early detection and proper management of abnormal blood pressure can prevent life-threatening complications. Thank you for watching. If you like this video, please like, subscribe and share. If you needed such more videos, please comment.